CAEP19. I'm Ken Milne, and we are here by the ocean, and I've got Dr. Louis, otherwise known as the Storyteller, and he was the first plenary session here at CAEP19. Welcome to CAEP.
My pleasure.
Well, it's good to have you here because I learned a few things from your CAEP plenary session. Now, for those of you who couldn't attend the plenary because of last night's basketball game, or for whatever reason, I want you to go through some of the highlights, but I'll give you my highlights first. Ready for this?
Ready.
Now, normally I have 5 things that I want to talk about, but I've been told we need to limit this to 5 minutes. So I'm going to use that as the benchmark, so we've got 5 minutes, but I'm going to say 3 things that were the highlights for me. Here are my 3 highlights from your talk. You met the guy who did the Glasgow Coma Scale. You met Dr. Salter. I don't know whatever happened to Harris. Like, he just sort of got
disappeared.
You know, and you've worked with Barney. I love you.
Well, the important thing to take home from the presentation is that we as emergency physicians have to do a better job taking care of these patients. Just fixing them up and putting them right back onto the street is not good. It's going to be difficult, but it's a population that needs our help. We've got to rise up to the challenge of meeting needs in a big way.
You know, if any sort of segment of the healthcare industry is poised to help homeless people, I think it's emergency physicians and emergency healthcare providers. I mean, we are the front line and we are the last line in defense, and it's a key social determinant of health. Homelessness, I mean, we're talking Maslow's theory of needs. I mean, food, shelter, warmth. They're missing all of these key components.
And so how do you expect them to get better? So it's up to us that have the means and the resources and the voice to be the voice for the homeless. It's going to be hard to do. It's not going to be easy. Most of us haven't been trained in building homes or finding real estate or rezoning. But if we're not going to do it, then who is going to?
You know, another really interesting part of that is when it comes to homeless people, I do see a lot of humor being used in talking about, oh, they're here for another chicken sandwich or a turkey sandwich. You know, it is so important if we just break bread with patients, listen to patients, and give them a smile. And that could mean the world to them, and maybe that's all they need.
And for a lot of patients, that's all I do. I let them sleep so they catch up on their fatigue. I feed them something, I let them shower, give them a fresh set of clothes, and then they say thank you, and then they just go back out to the streets again and represent in a couple of days.
Well, one of the definitions of insanity is doing the same thing over and over again and expecting a different outcome. So we need to do something different when it comes to our homeless population. We need to reach out beyond the walls of our emergency department and get out there so we don't just continue this cycle, because we have follow-up clinics for ICU patients, for trauma patients, for all sorts of medical conditions. But do we have anything for homeless people to go back to?
And you got to remember that right now, baby boomers are retiring. And baby boomers have time, experience, money, and connections. And since we started working on this project, we've had no less than 100 people step forward with the connections and resources that we need to make this successful. So, you know, work with baby boomers as they're retiring. They want to do something meaningful.
You know, I'm feeling something well up in my chest, and it's just a statement of, yes, we can. Yes, we can address this homeless patient population and make a difference. You can do it, CAEP19. You've had the plenary speaker. He's inspired you. He's certainly inspired me. Let's see what we can do.
Go Raptors!